And welcome to another exciting episode of
What's the Case?
This week's case report is entitled Bilateral Facial Paralysis, Case Presentation Discussion of Differential Diagnosis by Dr. Bilateral Jane. So in this week's report, we have a 34-year-old woman who came into the doctor, to the ER, complaining about a left side facial paralysis and weight loss, about 20 pounds.
In 1 month.
Yeah, and bilateral headaches. After this, the doctors tried to treat it, had one diagnosis, didn't work, gave her another one, still didn't work. Then they finally found out what it was. It was a very rare case, and that's why we're presenting on it in this exciting episode. So we'll get started with our the case presentation. Take it away, Jhordan.
All right. So as Neil just said, this woman came to the doctor. She had left side facial paralysis just on one side. She'd been experiencing headaches on both sides of her head and had experienced weight loss. Aside from that, she didn't really seem to have anything wrong with her. She had abstained from drinking, smoking, anything external that could have caused these things, and she was relatively healthy. So the doctor was confused, but his first diagnosis led him to believe that she had Bell's palsy, which is basically an idiopathic cause of facial paralysis. Idiopathic meaning that they really don't know what it comes from. So to treat her for this, the doctor gave her prednisone and acyclovir, but it didn't work. So a few days later,
she came back to the ER complaining now. Not only did she have facial paralysis on one side, but she had bilateral facial paralysis. And the way doctors diagnose bilateral facial paralysis is if within 30 days of the onset of the first side, you get the onset of your second side, so it becomes bilateral. They ran a lot of tests, all her vitals were normal, they couldn't figure it out, so they diagnosed her with Lyme disease this time.
She apparently was a teacher, or is a teacher, at a school where nearby in the woods there's a lot of deer foraging.
Very interesting.
Very. And so she was diagnosed with Lyme disease, and the normal treatment for Lyme disease is to get started even before the test results come back. So they did the test to ensure that she did have it, but they went ahead and started treating her. But it turned out she didn't have Lyme disease, and the presentation of bilateral facial diplegia continued. So once again, she found herself in the hospital.
2 days later, with severe headaches this time, really bad headaches. And they ran more tests, and this woman put up with a lot. She ended up having multiple biopsies done, MRIs, CAT scans.
She had a CT scan. They tested her for venereal diseases. They did white blood cell counts, red blood cell counts, gram stain, Lyme polymerase chain reaction against the Lyme disease. They basically did all sorts of tests. They took a cerebral spinal fluid biopsy as well to check for malignancies and abnormalities in her CSF. None of these things were positive except for the bronchoscopy with lymph biopsy, which turned out that she had granulomas.
Then they diagnosed her with neurosarcoidosis, which I guess they do say third time is the charm. So she's diagnosed with neurosarcoidosis, and they gave her prednisone and steroid therapy. And after 6 weeks, her facial paralysis and headaches had subsided. And after 8 weeks, they tapered her off the steroids, and she was completely healed.
And it should be noted, as Dr. Jane says, that this was the reason basically that she wasn't diagnosed earlier, is because this was an extremely rare presentation of bilateral facial diplegia. Only 0.9% of cases with bilateral facial diplegia are due to sarcoidosis, so that was not the main concern of the doctor at the time. Also, the cases that do have bilateral facial diplegia with neurosarcoidosis, even fewer of those cases actually have that as the sole symptom of presentation.
But now to talk about a little bit about facial paralysis or diplegia. It can be caused by multiple different things, including infectious diseases, neurological disorders, metabolic, toxic, vascular, or idiopathic. So there's several different forms of the etiology that can cause facial paralysis. And when comparing it to unilateral facial paralysis, unilateral is a little more common than bilateral, but for unilateral, the major cause is idiopathic, unfortunately, in 50% of the cases, whereas bilateral idiopathic causes only less than 20%, which is good for people who get bilateral facial paralysis. It means you have a better chance of it being cured.
But at the same time, if you have bilateral, just because the doctors and science can tell us why you have it doesn't mean that the underlying cause is curable. For example, it could be due to Parkinson's disease or multiple sclerosis. And it could be due to a number of different cancers, such as leukemia. That known factor, just because you know what is causing it, doesn't necessarily mean that it'll be able to be cured.
And in the second diagnosis of this 34-year-old woman, it makes sense that the doctor tried diagnosing her with Lyme disease, since Lyme disease is the most common infectious cause of facial diplegia, of bilateral facial diplegia.
Yeah. So, there you have it. If you want to find this article, again, the title is Bilateral Facial Paralysis, Case Presentation and Discussion of Differential Diagnosis. It is by Dr. Vishal Jain, and I encourage you to take a look at it. It's a nice article, and it definitely gives a good insight into the challenges in diagnosing some neurological pathology.
And this is my partner Jhordan and my name is Neil Bourgeois, and we'll be signing off, and thanks for stopping by, Neuroscience.